Hi there. So our PICO presentation will be looking into IVF versus natural conception, birth outcomes, and maternal mental health. Our PICO question is, in mother and child, how does natural conception compare to in vitro fertilization in regards to effects on birth outcomes and maternal mental health? So the purpose of a PICO question is to help guide a research study and attempt to implement the newly discovered information to the medical field and defend its significance.
Originally, we wanted to look into surrogacy success, but there wasn't a whole lot of information because we found out it was a new topic with regards to research. So instead, we decided to include in vitro fertilization as well as natural conception. We found a lot of information on birth outcomes, maternal mental health, as well as miscarriage reasons. We specifically chose to include in vitro fertilization and natural conception rather than using more broad terms to get more precise results within our Google Scholar searches. We found a gap in knowledge concerning surrogacy and routes of fertility that are not in vitro fertilization or natural conception. Alternative routes to reproduction is a newer topic in the medical world, so there's just not a lot of research done on it. So it's more up and coming. And because of this, we decided to narrow our search constraints to 10 years to ensure that they were recent, because in vitro fertilization specifically is just a new topic as well. And with these keywords, we were able to formulate our PICO question at hand.
My article looked at karyotype or DNA abnormalities in miscarriages. The sample was divided into women over 35 years of age and women under 35 years of age, as well as conception via IVF or natural conception. The study findings on type of karyotype abnormality in each sample group is presented in the pie graphs on the right. They also found that there were higher rates of miscarriage in women over 35 years of age and in women who conceived naturally. This being said, the best results were found in women who conceived via IVF and were under 35 years of age.
The article that I did my literature review on was Perinatal Outcome of In Vitro Fertilization Singletons, 10 Years Experience of One Center. The research problem studied in this article was, were there any significant differences in fetuses conceived from IVF versus natural conception? The sample used was women with singleton pregnancies in a health center located in Poland. The independent variables used were IVF and natural conception, and the dependent variables were the complications related to the pregnancies, related to the infant before and after birth, as well as the mother during pregnancy. The study design was an observational control study. The findings were that IVF pregnancies should be considered a higher risk than those of natural conception.
The research study I critiqued aimed to identify whether IVF affects the course of anxiety and depressive symptoms, as well as physiological stress from pregnancy to postpartum. The researchers sampled 60 women after successful IVF and 183 women who conceived naturally, evaluating them on 3 occasions from pregnancy through postpartum. They used questionnaires to indicate anxiety and depression symptoms, while they measured cortisol and amylase levels to indicate physiological stress. In the end, the researchers concluded that IVF is associated with increased anxiety and stress and decreased depression during the 3rd trimester of pregnancy. In the postpartum period, however, they found that IVF and natural conception mothers experience similar levels of anxiety, stress, and depression.
IVF nurses natural conception. So the purpose of this study was to provide a better insight into the influence of IVF-derived embryos on perinatal outcomes. The problem for this study was, does IVF have more negative outcomes on the baby and mother compared to a natural conceived birth? So the subject in this study were women who conceived naturally and women who conceived using IVF. The results of this study showed that babies conceived from IVF have more adverse birth outcomes such as low birth weight, preterm birth, increased birth defects compared to babies conceived naturally. Also, this study showed that mothers who used IVF had more cases of hypertension, placenta previa, need for antibiotics, need for cesarean section, gestational diabetes, and had increased miscarriage compared to those who carried naturally.
My research article dealt with the psychological well-being of surrogate mothers 10 years after their surrogacy birth. The researchers pondered the question, how does the psychological health and experiences of surrogate mothers change from 1 year to 10 years following the birth of the surrogacy child? The sample, there were surrogates in the UK. There's 34 originally in the first study done, and then 20 of the 34 followed up 10 years later. They were recruited originally from a different surrogacy study done at the same time in the UK, as well as from an organization. Findings, there were no signs of psychological distress within the surrogates, and there was no significant change from year 1 of the experiment to year 10.
When comparing and contrasting the findings from our individual critiques, we answered our PICO question by synthesizing conclusions rooted in the physiologic, psychologic, and overall success of IVF versus natural conception. As for physiologic effects, we synthesized that IVF birth mothers experience increased complications as compared to birth mothers who conceive naturally. This is evidenced by the number of physiologic complications found in Allison's article, including gestational diabetes, hypertension, and an increased need for cesarean section deliveries. Both Allie and Allison's articles spoke to increased incidences of placenta previa in IVF birth mothers. The researchers who composed my article found increased cortisol levels in IVF birth mothers during pregnancy. Each of these findings pose lasting effects for a birth mother's physiologic health and recovery, especially as they compare to the less stressful pregnancies and fewer birth complications experienced by natural conception mothers.
The research we found also showed that the route of conception impacted the baby physically. Babies that were conceived through IVF and were carried to term typically presented more complications. Both Allison and Allie's articles talked about premature birth, which comes with a whole slew of complications that include low birth weight and higher instances of birth defects. My article spoke more on the fetus's health during the pregnancy, and the findings of that actually contradicted that of babies carried to term. Babies conceived via IVF had less spontaneous abortions or miscarriages and less instances of karyotype abnormalities, which leads to healthier pregnancies. Looking at babies that were conceived naturally, Allie and Allison's articles both found these children were typically healthier with better health outcomes at and after birth. My article contradicted this again because the DNA samples from mothers who conceived naturally showed more abnormalities and higher instances of miscarriage.
We also synthesized that assisted conception means of pregnancy can positively influence birth mother mental health if they are to influence it at all. My article concluded that the differences in IVF versus natural conception birth mother mental health is negligible in the postpartum period in terms of depression. Complementarily, Travis's article showed no differences in the psychological well-being of surrogate mothers in the 10 years following childbirth in terms of depression also. Nevertheless, both of our articles showed minimal yet still present indications that assisted conception means of pregnancy can result in decreased birth mother depression symptoms, whether it be short or long term. Despite this information, and based on the limitations of Travis's article, the limitations of my article, and the heavy emphasis on only physiologic effects within our group members' articles, it is clear that there is a need for increased research on assisted conception means of pregnancy as it relates to birth mother mental health.
When compiling the information from our research articles, we could clearly see how multifactorial this topic is. If we take a step back and look at it all, there is no clear pattern that shows a superior means of conception. Solely looking at birth outcomes makes natural conception the better choice, whereas occurrence of miscarriage makes IVF look better. When looking at mental health in the birth mother, different variables can affect it in the short term and long term. Looking at it from an even broader standpoint, outcomes for mom and baby are affected by more than just how the child is conceived. This is evident by clinical and demographic variables such as previous miscarriages and maternal age. The bottom line is that there is no best option for everyone because there are so many factors to this topic that can affect one pregnancy and not another.
Each of our articles ties together to relate to nursing practice and the application within our field. Patient education is very significant in ensuring the best quality care. By educating on the different complications that arise from in vitro fertilization as well as natural conception, the birth mother is able to be better informed on the topic and prior to conception is able to decide the best option for her. Educating on all other alternatives as well is very significant, including surrogacy, natural conception, and adoption. Educating the family members on the cost of in vitro fertilization is also very significant, as for many family members this may be too expensive of an option. Educating to increase the awareness about the effects on mental health can help the birth mothers to find resources to combat these challenges during, before, and after pregnancy. Having greater knowledge regarding the options and advocating for the patient to achieve their wishes is known as a concept called patient-centered care, which is essential in providing the best quality care for our patients. Ensuring that they have good mental health in the birth mothers can also help to prevent worsened health complications and promote early intervention as well as well-being. Understanding complications can also help the nurse to make better decisions for the mom and baby as they arise. Overall, understanding the relationship of the article's findings on IVF versus natural conception is very significant in providing the best possible care for our patients.